Hello, I'm Dr. Melissa Ehlers. I am the program director here at Albany Medical Center. I'm a professor of anesthesiology and director of the pediatric anesthesia division here. And I've been program director since 2015. And this talk is to give you hopefully a broad overview of our program and what it has to offer. I am going to give you a as brief as possible overview of what our whole program is about, talk about the hospital, what our department is like, go through some of the other personnel program, etc. I wanted to point out here is a picture of our Albany Medical College graduation, and this takes place yearly at the Saratoga Performing Arts Center, which is ranked as the #1 to #2 outdoor venue in the U.S. for various musical groups that come here, as well as ballet, orchestra, symphony, etc. So a lot of nice cultural things to see in the area. Our medical college was founded in 1839 and the hospital founded in 1849. Neither of those two original buildings still stand, and the actual medical center now, which is combined into one very long building, is in a slightly different part of Albany. We acquired South Clinical Campus, which is a very small hospital about 2 blocks away. That's where we do our ambulatory care, and you can see a picture of that. There's 8 ORs there. It's a elective rotation you can go to during your last year of anesthesia. Our institution has been lucky enough to be growing. We have incorporated into the Albany Med Health System Columbia Memorial Health, which is located about an hour and a half to our south. Glens Falls Hospital, located an hour to our north, and Saratoga Hospital, which is located about half an hour to our north. Because we are affiliated with these other hospitals, it improves our buying power and gives us leverage with the reimbursement factors from insurance companies in the local area. Currently, we do not have any of our residents rotate to these other locations. However, possibly in the future, several years down the road, that might be a possibility if it was felt to be advantageous to the program. In this aerial shot, you get a view of the whole campus of Albany Medical Center. You can see the college up in the top part of the picture. You can see the Masry Family Children's Emergency Room off to the right, as well as the Adult Emergency Department. Down below that, slightly to the left, is the Patient Pavilion. And some of those windows in there are actually windows outside of our operating rooms, which means that yes, we do get to see daylight during the day, which can be very helpful to our wellness, I think, being able to see outside. In addition, you can see that there are several flyovers over the street that afford us an ability to get over to the parking garages, as well as to Panera and Starbucks, without having to really step foot outside, which can be helpful during the winter months. Our Albany Medical Center has become part of a health system, so that includes 4 hospitals that we mentioned earlier, our children's hospital within a hospital here. Of course, we have the medical college, and then a visiting nurses association. As you can see, we have a large number of employees, over 16,000. We have 125 locations, including all of our urgent meds and physician offices, 800 plus physicians, 60 plus specialty areas. So we really are the quaternary referral for this entire 26 to 27 county region. Working. We have 766 beds. We are a children's hospital within a hospital. We do all specialties of cardiac, including congenital hearts. All surgical subspecialties are represented. We have tons of high-risk OB, and we are the busiest level 1 trauma center in New York State, believe it or not. In 2013, we moved into our new OR and ICU tower. They have 20 new OR operating rooms in B building, as well as another 15 in the C building, for a total of 35 ORs that we are running on any one day. In addition, there is a brand new PACU on both of those floors, and 2 new ICUs, a new SICU and a new neonatal ICU. This is an example of what all of the new ORs look like. They all would include a standard anesthesia machine. So once you learn one machine, that's all you need to know for all the other ORs. An anesthesia cart, which is standardized throughout the institution. So anywhere you go to do an anesthetic, you'd find everything in the same exact drawer. And a Pyxis, which can be found in each operating room. This makes it incredibly convenient for you to be able to remove a wide array of narcotics, controlled substances. All the drugs that you need to provide your anesthetic are usually contained within that Pyxis, and it allows you to waste those drugs with any licensed provider at will. In addition, you can see the surgical boom, which has a plug-in for Stort's equipment, so we can use that when we are utilizing teaching laryngoscopes, for instance, and there are multiple overhead screens so that we can easily view the surgical field when laparoscopic procedures are being done. This is an example of one of the PACUs, and more specifically, this is the pediatric PACU, which you can tell by the fish on the floor, as well as floating up around the ceiling. And at the bedside of each pediatric PACU bay is a rocking chair for the parent of the patient to get comfortable in while they're waiting for their child to wake up. Albany Medical Center serves approximately 25 counties. You can see in orange, those are the nearby counties where patients might be coming to us for simpler procedures like hernias, things like that. Once you get up to the green areas, that's more of our tertiary service area. So there are small hospitals located in those areas, but those hospitals don't have all surgical subspecialties represented. So therefore, patients may be traveling from those counties down to Albany Med for specific care. As you can see, we also extend into Bennington County in Vermont and then Berkshire County in Massachusetts. Additionally, we frequently see patients actually from Pennsylvania who may come up here for care as well. Our department currently has 65 faculty. We take 6 residents per year, and we have 58 nurse anesthetists, many of whom are part-time, as well as a student nurse anesthesia school here, which has approximately 25 members per class and helps as a feeder to provide us with nurse anesthetists when they graduate. Most of those student nurse anesthetists do their rotations at outside institutions. So at any one time, there typically are only 4 or 5 of them rotating here at Albany Med. We have a wonderful group of perfusionists, super anesthesia techs, approximately 14 in number, who provide wonderful support so that you're not stuck doing a lot of room turnovers or having to find a lot of equipment. Instead, they can be doing that while you're concentrating on the patient. And we have a fantastic administrative support and billing staff who will make sure that all of your proper documentation gets submitted in a timely manner and you're not having to run around and find some notes 3 days later. During your clinical base year, which we have specifically built to complement our anesthesia program here, you can expect to do 5 months of internal medicine, and that may include up to 1.5 months of night float, sometimes at the VA, which is directly across the street from us, but more so at Albany Med. You may do, and you do also go to the medical ICU and the coronary care unit for 1 month, and those rotations have proven to be very educational for our interns. In addition, you do 1 month pediatric specialty inpatient. Typically that is on the HEMOG service, where you get to care for some really sick kids, and they have wonderful teachers on that service. 1 month in the pediatric ICU. Again, a great opportunity to see children coming back from congenital heart surgery, as well as kids presenting with a wide host of various conditions that need to be treated. We are the only PICU in the surrounding 26 counties, so pretty much all sick kids would be coming our way. In addition, 1 month of emergency medicine. We try to find you 2 weeks to do research within our department, 1 week typically in the first 6 months so that you can get a project started, another week in the second 6 months so that you have time to further work on it, maybe recruit patients if it's prospective, or do data collection if it's retrospective. Also a 1 week QI project, and then 1 to 2 weeks of elective time. In addition, somewhere in there you'll do 2 weeks of a preoperative assessment clinic and 6 weeks of enhanced recovery after surgery. This has proven to be a very popular rotation. During that time, you will be interfacing with a couple nurse practitioners who do the bulk of the rounding on the patients. You will, however, be participating with seeing the patients before their surgery, helping to set expectations, counseling them on what the particular pathway we're going to use for pain control during the procedure. And you typically get to place a lot of blocks. Actually most of our interns have finished their intern year with over 100 blocks under their belts already. And since you only need 20 to graduate, that is a pretty considerable number. And then finally, of course, 1 month of vacation is given during your intern year. During your clinical base year, we highly encourage you whenever possible to attend the afternoon lectures that are given every Monday at 3 p.m. to our CA1s. Those lectures are aimed at passing the basic exam. We provide you with textbooks early on during your intern year where they may be helpful on some of your rotations. We encourage you to attend journal clubs whenever you're able to, and also come to the quarterly dinner meetings, which are at local restaurants when District 4 of the New York State Society of Anesthesia meets. In addition, we hope to foster a collaborative early relationship with you through your interaction with us during your ERS rotations, as well as pre-op research, QI, and any elective pain rotations that you may take with us. Here is a slide of our happy residents having lecture in the lecture hall. The rest of CA1 year, once you get through the introductory course, consists of 3 more months of being in general OR type cases. Again, sometimes those can be fairly complex cases because we have a lot of sick patients coming even for a lap chole, but the patient may have a hypertrophic cardiomyopathy or other things going on. So you will be challenged during those 3 months. Then you're going to start your subspecialty rotations starting in November or December. And we do this because we feel it's really important for you to get exposure so that you can have some idea if you want to do a fellowship, which you typically need to apply for during your CA2 year. So you'll do an airway rotation, you'll do a month of cardiac, month of SICU, OB, neuroanesthesia, pediatric anesthesia, and regional/acute pain. This is an example of what one of those schedules would look like. Quick review that the ABA has a staged examination system, and you do have the advantage that both the chair, Dr. Jones, and myself are both senior board examiners, so we are intimately acquainted with all the details of what the applied exam entails, and get frequent updates on any changes that are happening to the basic or advanced exams. And of course, the basic exam is the first high stakes exam that you'll take at the end of your CA1 year. It is a must-pass exam for you to be able to advance further and graduate. As its name implies, it prepares you or tests you on basic things: pharmacology, physiology, anatomy, anesthesia equipment, and basic monitoring, versus the advanced exam, which will focus more on subspecialty type topics. The basic exam started in August 2014. Again, this is what our Monday afternoon basic science curriculum is aimed at, to get you ready to take this test in the end of your CA1 year. And here is one of our lecturers lecturing to the CA1s. Here is a sample of how our didactic schedule run. Typically, we do general anesthesia topics for the first month, segue to cardiac, then ICU, regional, some ITE review right before you take the in-training exam, and then go to OR, peds, PACU, neuro, thoracic, chronic pain, so that we cover basically all of the subspecialty areas that need to be covered. Here is our auditorium that we use for grand rounds. Grand rounds occurs every Thursday morning from 7 to 8 a.m. This is protected time when the ORs are not running. Typically, the first Thursday of the month is a business meeting where the residents would meet in your resident room with your chiefs. It's an opportunity to discuss any issues that are coming up, and any problems that you foresee. Things that need to be brought back to me can be brought back at that point, and usually I have discussion topics for the residents to talk about as well. But then the other 2 or 3 weeks are usually filled with people who are coming from outside the institution or inside the institution to talk about various topics. And then, of course, M&M is usually one of the Thursdays of each month. Journal Club is done on an approximately monthly basis. We do a dissection of the statistical methods used, since there is a fair amount of statistics on your basic exam and on your advanced exam. Dr. Silverman, who is head of our acute pain rotation, is wonderful at delving into this, and 2 residents will take turns presenting this critical review of the literature. During CA2 year, you can expect to move on to slightly more difficult rotations. You'll do actually now a full month of PACU, which is also integrated with that half month of focused transthoracic echo. Then another repeat of neuro, cardiac, SICU, a month of vascular. We have a very active vascular service. You get to do a month of chronic pain here, and then another month of acute pain, regional, also 2 months of thoracic, a month of pediatrics, and a month of OB again. This is an example of a master schedule, again showing those rotations. Here is a picture of one of our chief residents performing a block. He went on to do a PEDS fellowship out in Arizona and is currently practicing at a children's hospital in Colorado. Here's a quick look at a case log total from one of our residents. As you can see, the numbers in blue are the required minimums and the total are over here in red. So this resident was well above the required minimum on these cases. And then you'll note here their total peripheral nerve blocks are in the 400 range. I'd say that we frequently, most of our residents actually now are graduating with over 500 blocks, sometimes in the 600 range. So you will definitely be very comfortable with them. Our residents have had the opportunity on a yearly basis as CA3s to go to various countries on mission trip opportunities, and we just joined the Global Academic Anesthesia Consortium, which also I guess you could pronounce as GAC. And this is a group of academic anesthesia residencies around the country who are banding together to provide a consistent healthcare opportunity, mission opportunity in Zambia in Africa. So we will be sending residents and attendings there for 2 weeks, the same 2 weeks every year, as well as providing a lot of long distance learning opportunities. So residents can participate both in the long distance learning opportunities via Zoom, for instance, and or they can travel there on these mission trips. So we're very excited about this in the future. Just a brief word right here on what we think are our new and exciting things coming up for 2023 and beyond. We continue to expand our use of focused transthoracic echo. Dr. Niebers-Bergrara, who is a critical care anesthesiologist, is a very firm believer that we all should be wearing a ultrasound probe, personal ultrasound probe around our necks instead of a stethoscope. So we are endeavoring to keep on pushing this into all areas of anesthesia. We have a very robust perioperative surgical home, which we also call enhanced recovery after surgery, or ERAS here. So we have many surgical services that are clamoring to be part of this as well. We continue with the very successful systems-based practice week, and then followed by a research week and holiday. We do this starting in the middle of December. This enables us to get you out of call rotations during intern year around the holidays, and is probably your last opportunity to take off that week of between Christmas and New Year's. At least during residency. So we are very happy to be able to provide that. And then we're always looking to further our development of our wellness curriculum based on input from the residents, continue and expand upon our oral board review sessions. And we have also integrated some research or wellness, either mornings and or they may be full days, and we actually give you 2 full days of wellness that you can pick during each year of residency. Our Clinical Competency Committee, or the CCC committee, meets on a quarterly basis, and the purpose of this is for us to review all of your evaluations and make sure that we are effectively giving you feedback, so that if there are any issues we see with your future competency, we want to give you immediate feedback right away and help you come up with a individualized plan in order to remediate any issues that we see. We have a beautiful simulation center where you can see through this glass pane. Here is an OR that is set up to mock our ORs, and we run simulations here typically about once a month, if not more frequently, for the residents. There is a TEE simulator over there in that simulation area. So what do you really want to know? Some of the nuts and bolts of our program. And on this slide, you can see the 2022 to 2023 house staff salaries that we are pleased to provide here at Albany Med. As far as call team, there are 2 attending anesthesiologists in-house at all times. We also have one resident plus 2 to 3 nurse anesthetists to cover the 4 ORs, which can be running simultaneously on a really busy night. In addition, up in OB, we would have either a resident or a nurse anesthetist covering up there. Monday through Friday, we have a resident covering the ORs late until 8 p.m. typically. In addition, we have many CRNAs working swing shifts so that there are extra people around to help relieve people around 4:30 so that they can get home on time. If needed, we have backup attendings for both cardiac and pediatrics that will come in from home. Resident call hours, we have made every effort to keep them quite reasonable here. On average, our queue is about Q6, so you would expect to take 2 to 4 calls per month. Our call is for a 24-hour call, and you have the next day off. And you would have 1 to 2 8 p.m. Late person shifts per month as well. Our residents average about 50 to 55 hours per week, and rarely would be any higher than that unless you are doing moonlighting, which you do get paid for, but does contribute to call hours. As far as leave and conference time, the ABA mandates that you only get 20 days per year, which is 4 weeks off, and then an additional 5 days conference time. Discretionary money is on a graded basis. However, I will say we tend to take the money, pool it so that we can buy you all of your textbooks up front, which are very expensive. And then, as I mentioned, anytime you are going to a conference with a poster, we as a department take care of paying so that you can go to that conference. Resident contract can be found at this URL. Everybody, of course, gets a criminal background check on initial hire. A drug test is done, but then after that is only for cause. So what do our residents do after graduation? Well, many join the faculty. We currently have over a third and close to 1/2 of our faculty comprised of former graduates from this program. Private practice would then constitute the other half. We have a very fellowship-friendly residency, so many people choose to do fellowship coming out of here and have not had any issues with finding those fellowships. Here at AMC, we have a pain fellowship, which is under the neurology umbrella. We are anticipating starting a critical care fellowship imminently, and we do have a cardiac fellowship, which takes 1 fellow per year. In the past 15 years, our ABA board certification rate has been 95%, and you can find many of our graduates in leadership positions locally, both here at Albany Med, but also in the other private practices in the area. We have never had any issues with accreditation with the ACGME. Our last site visit was July of 2011. Only about 1/4 of programs get 5 years, which is the maximum amount that you could get for accreditation, and we got that for the past 4 site visits before that. Now we are accredited annually, and we currently have a clean letter, meaning they don't see any issues with our program that they think that we need to address. And we will be having our next accreditation site visit in 2023. This is a map of New York State. As far as things to do in the area, besides all that Albany has to offer, we are a pretty quick drive or train ride, about 2.5 hours to New York City to the south, about 3 hours to the east to get to Boston, maybe 3.5 hours to the north to get to Montreal. So there is a lot to see and do, both in the Albany area, but also within a 3-hour radius. Lots of great hiking, water sports, skiing in this area. Here's one of our attendings hiking the Adirondack Peaks. And this is a winter view of some of those peaks. Dr. Green on our faculty is close to having finished all of the winter 46 peaks. Here's a picture of beautiful Saratoga Lake where I live. Wonderful water skiing, wakeboarding opportunities up there on that lake, and a great place to swim. A tranquil pool, also shot by yet another chief resident when he took his family hiking and happened upon this. More pictures from this same resident, and a beautiful sunset up in the Adirondacks. And finally, here are pictures of some of the members of our anesthesiology recruitment committee. As a reminder, you will be meeting with up to 6 of the members of this committee during your interviews. We typically do it with a 15-minute kind of speed dating interview. So you get 15 minutes with each of those 6 people. Then at the end, you will get to meet with myself, the program director, and ask questions. And you'll also get another opportunity to hang out virtually with the residents and ask them any remaining questions that you might have about the program. Thank you again for considering our program, and especially for getting to the end of this long presentation. Sorry about that, but hopefully I provided you with lots of details which you can use in making your selection. Best of luck to you in the future, and even if you don't come here for residency, please consider us for an attending position down the road. Thank you.